Imagine walking into a hospital expecting to fix one health problem, only to wake up facing two new complications you never saw coming. It happens more often than most people realize, not because surgeons are careless, not because hospitals lack advanced technology, and not because every surgery is dangerous. The real issue is that after age 60, the body responds to major surgery very differently than it did decades earlier. Two people can undergo the exact same procedure. One returns home within days and quickly regains independence. The other spends weeks or even months recovering from unexpected complications. Why does this happen? And how can you know if surgery is truly your best option, or if a safer alternative might give you a better quality of life? Stay with me, because one of the surgeries we'll discuss today surprises even many healthcare professionals, and understanding it could help you avoid a life-changing mistake. Hello, I'm Dr. Michael Reed. For over 20 years, I've helped patients make some of the biggest medical decisions of their lives. One thing I've learned is that the success of an operation isn't measured only by what happens inside the operating room. What truly matters is what happens afterward. Can your body recover? Can you regain your independence? Can you return to the life you enjoy? Those are the questions every patient deserves to answer before agreeing to major surgery. Today's video isn't meant to create fear. Modern surgery saves millions of lives every year, but after age 60, every operation deserves careful consideration. Today, I'll explain 5 major surgeries that require extra caution after 60, why they can be riskier than many people realize, and the important questions you should ask before making a decision. Because once you understand these hidden risks, you'll never look at a surgical recommendation the same way again. Before we begin, it's important to understand one key fact. For adults over 60, the biggest challenge often isn't surviving surgery, it's recovering from it. As we age, our heart, lungs, kidneys, brain, and immune systems still work well, but they have less reserve to handle major physical stress. That's why a procedure that a healthy 45-year-old recovers from in weeks may take months for someone in their 70s. General anesthesia can also affect older adults differently, sometimes causing temporary confusion, memory problems, or mental fog during recovery. This is often related to something doctors call frailty, a reduced ability for the body to recover after physical stress. So before asking, "Can I survive this surgery?" ask the more important question. Can my body recover well enough to return to the life I want? With that in mind, let's begin with the first surgery on our list. Part 2. Surgery number 1. Open heart surgery. The first surgery on today's list has saved countless lives over the years. Open heart surgery. For the right patient, it can be one of modern medicine's greatest achievements. It restores blood flow, relieves chest pain, and helps many people live longer, healthier lives. But here's what many older adults aren't told. Not every patient benefits in the same way, especially after the age of 60. Traditional open heart surgery places enormous stress on the body. In many procedures, the heart is temporarily stopped while a heart-lung machine takes over circulation. Although this technology is remarkable, recovery demands a lot from the heart, lungs, kidneys, immune system, and brain. For younger people, the body often handles this stress well. For older adults with diabetes, kidney disease, lung problems, or other chronic conditions, recovery can be much more difficult. Complications such as infections, kidney problems, prolonged weakness, or temporary memory changes are more common during the recovery period than many people expect. This doesn't mean open heart surgery is a bad choice. In fact, it saves lives every single day. The real question isn't, is open heart surgery dangerous? It's, is it the best option for me? Today, many patients may qualify for less invasive procedures. Some heart valve problems, for example, can now be treated using catheter-based techniques that require only a small incision instead of opening the chest. These procedures often lead to faster recovery, shorter hospital stays, and less physical stress on the body. Of course, not everyone is a candidate, but many patients never know these alternatives exist because they never ask. Before agreeing to major heart surgery, ask your surgeon, are there any less invasive options available for my condition? That single question could completely change your treatment plan, because sometimes the best surgery isn't the biggest one. Now let's move to the second surgery on today's list, one that millions of older adults consider every year because of chronic back pain. Part 3. Surgery number 2. Spinal surgery. Let's move to the second surgery on today's list, spinal surgery. Millions of adults over 60 live with chronic back pain. For some, it's a constant ache. For others, every step becomes painful. After months or even years of discomfort, Surgery can seem like the only solution, but here's what many people never hear. Not every painful spine needs surgery. Many MRI scans show arthritis, disc degeneration, or spinal narrowing in people who have little or no pain. At the same time, some people experience severe pain even though their scans show only minor changes. Pain is far more complex than imaging alone. Now, there are situations where spinal surgery is absolutely necessary. If nerves are severely compressed, if bladder or bowel control is affected, if muscle weakness is getting worse, or paralysis becomes a risk, surgery may be the best and sometimes the only option. But these cases are very different from age-related chronic back pain. One of the most common procedures offered is spinal fusion. During this operation, 2 or more vertebrae are permanently joined together to stabilize the spine. For carefully selected patients, it can provide significant relief. However, fusion also changes the way your spine naturally moves. When one section no longer moves, the surrounding joints often absorb more stress. Over time, those areas may wear out faster, and some patients eventually need additional surgery. Recovery also takes patience. Healing can take several months, and physical therapy plays a major role. For older adults with osteoporosis, diabetes, heart disease, or limited mobility, recovery is often slower than expected. Before deciding on spinal surgery, ask yourself one important question. Have I explored every reasonable non-surgical treatment first? For many people, structured physical therapy, targeted exercises, weight management, pain management, anti-inflammatory treatments, or carefully selected spinal injections may provide meaningful relief without major surgery. These treatments don't work for everyone, but surgery should usually come only after you've fully understood every available option, because once spinal fusion is performed, it cannot be reversed. Taking time to make the right decision today may prevent bigger problems in the future. Now let's move to the third surgery on today's list, a diagnosis that instantly creates fear in almost every family: cancer surgery. Part 4. Surgery number 3. Major cancer surgery. Few words create more fear than one simple diagnosis: cancer. The moment most people hear that word, their first thought is, get it out as quickly as possible. That's a completely natural reaction, but here's something every patient deserves to know. The goal of cancer treatment isn't just removing a tumor. The real goal is helping someone live longer while preserving the best possible quality of life. And those two goals aren't always achieved the same way. This becomes especially important for adults over 60 who may already have heart disease, diabetes, kidney problems, or other chronic conditions. Sometimes, the operation itself places more stress on the body than many patients expect. Take pancreatic surgery, for example. It's one of the most complex operations in modern medicine. The procedure can last for many hours and may involve removing part of the pancreas, nearby organs, and surrounding tissue. For younger, healthier patients, it can be life-saving. But for older adults with multiple health conditions, recovery can be extremely challenging. Even when the surgery is technically successful, complications such as infections, delayed healing, digestive problems, or prolonged weakness may follow. That's why experienced cancer specialists don't ask only, "Can we remove the cancer?" They also ask, "Will this treatment give the patient the best overall outcome?" The good news is that surgery is no longer the only treatment option for many cancers. Depending on the cancer's type and stage, some patients may benefit from targeted therapy, radiation therapy, immunotherapy, chemotherapy, or a combination of these treatments. Sometimes these approaches are used before surgery. Sometimes they reduce the need for major surgery altogether, and in certain situations, they may provide similar results with less physical stress. Every case is different. That's why no treatment plan should be based on fear alone. Before agreeing to major cancer surgery, ask your medical team, are there other treatment options that fit my age, overall health, and cancer stage? That single conversation may completely change your treatment plan, because the strongest medical decision isn't always choosing the biggest operation. It's choosing the treatment that's right for the whole person, not just the disease. Now let's move to surgery number 4, one of the most common procedures performed every year: hip and knee replacement. Part 5, surgery number 4, hip and knee replacement. Now let's move to surgery number 4, hip and knee replacement. Every year, millions of people regain their mobility because of these procedures. Many patients who once struggled to walk, climb stairs, or sleep without pain are able to return to active, independent lives. For the right person, joint replacement can be life-changing. But after the age of 60, success depends on much more than the operation itself. Recovery requires strength, good nutrition, physical therapy, and patience. Older adults with diabetes, heart disease, obesity, osteoporosis, or poor muscle strength often face a longer and more difficult recovery. The surgery may go perfectly, but if the body isn't prepared, regaining mobility can take much longer than expected. That's why many orthopedic specialists now emphasize prehabilitation, preparing the body before surgery. Simple improvements such as gentle exercise, strengthening the muscles around the joint, eating a protein-rich diet, and managing chronic medical conditions can significantly improve recovery. Just as important is understanding what recovery will actually involve. Many people focus only on the operation itself, but after surgery comes weeks of rehabilitation, daily exercises, follow-up appointments, and gradual rebuilding of strength. The operation is only the beginning. The real success comes from the work that follows. Before scheduling a hip or knee replacement, ask your surgeon, "What can I do before surgery to improve my recovery?" That one question can help you prepare both physically and mentally for a smoother healing process. It's also important to have realistic expectations. The goal isn't simply getting a new joint. The goal is returning to a more active, independent, and pain-free life. For many patients, joint replacement is absolutely the right decision, but the best results happen when surgery is performed at the right time, for the right patient, with the right preparation. Now let's move to the fifth and final surgery on today's list, one that usually happens without warning. Emergency abdominal surgery. Part 6. Surgery number 5. Emergency abdominal surgery, plus 4 questions. Every patient should ask now. Let's move to the fifth and final surgery on today's list. Emergency abdominal surgery. Unlike the other procedures we've discussed, this is usually not planned. It often happens suddenly because of a blocked intestine, a perforated bowel, internal bleeding, or a ruptured appendix or gallbladder. In these situations, surgery is often life-saving and cannot be delayed. The challenge is that many older adults arrive at the hospital already dehydrated, weak, or seriously ill. That leaves the body with very little reserve to recover after the operation. Recovery may involve infections, pneumonia, kidney problems, blood clots, or a longer hospital stay. This is why it's so important not to ignore warning signs. Severe abdominal pain, persistent vomiting, a swollen abdomen, high fever, or blood in the stool should never be dismissed as just stomach problems. Seeking medical attention early may prevent a small problem from becoming a life-threatening emergency. Now that we've discussed the 5 surgeries that deserve extra caution after 60, let's talk about something even more important: the questions you should ask before agreeing to any major operation. These 4 questions can completely change the conversation you have with your doctor. Question 1. What happens if I don't have the surgery right now? Some conditions require immediate treatment. Others allow time to think, improve your health, or seek another opinion. Understanding the consequences of waiting helps you make a more informed decision. Question 2. Are there less invasive or non-surgical alternatives? Medical treatments continue to improve every year. For some patients, medications, physical therapy, injections, or minimally invasive procedures may provide similar benefits with fewer risks. You'll never know unless you ask. Question 3. What are the risks for someone my age and with my medical conditions? Every patient is different. A healthy 65-year-old and an 80-year-old with heart disease may face very different recovery challenges. Your treatment should be based on your overall health, not just your diagnosis. Question 4. What can I do before surgery to improve my recovery? Preparing your body before an operation can make a remarkable difference. Improving nutrition, managing chronic illnesses, staying as active as possible, and following your doctor's recommendations can all help reduce complications and speed up recovery. Remember, good medical care isn't built on blind trust. It's built on open conversations and informed decisions, because the more you understand, the better choices you can make for your health. In the next part, we'll discuss how to prepare for surgery, why getting a second opinion matters, and the warning signs that should never be ignored. Part 7. Prepare before surgery, get a second opinion, and watch for these red flags. If you and your doctor decide that surgery is the right choice, remember this: the operation lasts one day, recovery lasts much longer. What you do in the weeks before surgery can have a major impact on how well your body heals afterward. Many people prepare their paperwork and hospital bag, but forget to prepare their body. Simple steps like eating a balanced, protein-rich diet, staying physically active within your limits, managing blood sugar and blood pressure, stopping smoking if possible, and reviewing your medications with your doctor can all improve your chances of a smoother recovery. If you wear glasses or hearing aids, bring them to the hospital. Being able to clearly see and hear after surgery can reduce confusion and help you recover more comfortably. Don't be afraid to get a second opinion. One of the smartest decisions you can make before major surgery is getting a second opinion. Some patients worry this might offend their surgeon. In reality, experienced surgeons often welcome it. Medicine isn't always black and white. Two highly qualified specialists may recommend different treatments based on the same medical information. That doesn't mean one is wrong. It simply means every case is unique. Bring your medical records, scan reports, lab results, and a list of your medications. Write down your questions before the appointment so you don't forget anything important. A second opinion isn't about doubting your doctor. It's about making the most informed decision possible. 4 warning signs you should never ignore. Before agreeing to surgery, pay attention to these red flags. First, if you feel rushed into making a decision without enough time to think or ask questions. For many planned surgeries, taking time to understand your options is completely reasonable. Second, if only surgery is discussed and no alternative treatments are explained, a good doctor should help you understand every appropriate option, not just one. Third, if no one clearly explains what could happen if you choose to wait. Sometimes delaying surgery briefly to improve your health or gather more information is perfectly appropriate. You deserve to know the benefits and risks of every choice. Fourth, if your questions are dismissed or treated like an inconvenience, a skilled surgeon should welcome your concerns and answer them with patience and respect. Never go alone. Finally, whenever possible, take a trusted family member or close friend to important surgical consultations. When people hear words like heart surgery, cancer, or we need to operate, fear can make it difficult to remember everything the doctor says. A companion can take notes, ask questions you may forget, and help you review the information afterward. Remember, healthcare should never feel rushed or confusing. The best doctors want their patients to fully understand every recommendation before making such an important decision. Now, before we finish, let's bring everything together with the most important lesson from today's discussion. Part 8. Final conclusion plus call to action. Before we finish today's video, let's quickly review what we've learned. Today wasn't about avoiding surgery. It was about making better informed decisions. Modern surgery has saved millions of lives and continues to do so every day. But after the age of 60, every major operation deserves careful thought. We discussed 5 surgeries that require extra consideration. First, open heart surgery, a life-saving procedure for many patients, but it's always worth asking if a less invasive option could provide similar benefits. Second, spinal surgery. Sometimes it's necessary, but many people should first explore physical therapy, exercise, pain management, and other non-surgical treatments. Third, major cancer surgery. Removing a tumor is important, but the ultimate goal is to improve both survival and quality of life. The best treatment isn't always the biggest operation. Fourth, hip and knee replacement. These procedures can restore independence, but preparation before surgery often has a huge impact on recovery afterward. And fifth, emergency abdominal surgery. The best protection is recognizing warning signs early and seeking medical care before a condition becomes life-threatening. If there's one message connecting all 5 surgeries, it's this: every patient is different. The right treatment depends on your age, your overall health, your medical history, and your personal goals. Never feel afraid to ask questions, never hesitate to seek a second opinion, and never allow fear to make one of the biggest medical decisions of your life. The best healthcare happens when doctors and patients work together. Your doctor brings medical knowledge and experience. You bring your values, your lifestyle, and your goals. When those two come together, the best decisions are made. Growing older doesn't mean giving up your choices. It means becoming a more informed patient. Always ask, is this really my best option? Are there less invasive alternatives? What happens if I wait? What can I do to improve my recovery? Those simple questions could make a life-changing difference. If today's video helped you better understand surgery after 60, please support the channel by clicking the like button and subscribe for more practical health advice designed to help you live a longer, healthier, and more independent life. I'd also love to hear from you. Have you, or someone close to you, ever been advised to undergo surgery? What questions did you ask, or what do you wish you had asked? Share your experience in the comments below. Your story may help someone else make a more informed decision. Thank you so much for watching. I'm Dr. Michael Reed. Take care of yourself. Stay informed. Keep asking questions. And remember, one of the most powerful tools in modern medicine isn't just advanced technology. It's an informed patient who understands they always have the right to ask one more question. I'll see you in the next video.